want to take this opportunity, ladies and gentlemen and distinguished delegates, to warmly welcome you to this segment of a side event where we're going to be discussing a very thematic issue and a contemporary issue in the health of our adolescents and young people and towards the country's response to end the HIV and AIDS epidemic.
Counties continue to be cornerstone for promoting and securing the health of Kenyan people, supported by the national government in accordance with the 4th schedule of the Constitution of Kenya. Over the last 13 years, tremendous progress has been made across all 47 counties, which are our devolved units in HIV response and other endemic diseases. Over the same period, the NSDCC has continued to forge close collaboration, cooperation, and consultation with the county governments to keep the journey towards ending the public health threats posed by HIV and other endemic diseases on course, an undertaking that has registered a great degree of success.
It is both a duty and an honor to join you today as we pool our ideas, discuss solutions, and develop integrated, sustainable approaches to addressing the triple threat facing Kenyan adolescents, namely pregnancies, new HIV infections, and sexual and gender-based violence. I stand before you today not only as the governor of Elgeyo Marakwet, but as one of you. I also speak on behalf of my colleagues at the Council of Governors and partners in the government to express our profound concern over the growing challenge of triple threat, new HIV infections, adolescent pregnancies, and sexual and gender-based violence. The impact of triple threat in counties. The triple threat of new HIV infections, adolescent pregnancies, or I can say to shorten up the triple threat, remain a significant health challenge for adolescent and young people in Kenya. In our country, for example, the situation every week, we record an estimated 54 new HIV infections among adolescents of 10 to 19, alongside 4,633 adolescent pregnancies and 334 reported cases of sexual and gender-based violence. We have strengthened our Ngao partnership through NSDCC. We had a meeting with all our chiefs and assistant chiefs and village elders, and we had a lot of programs that we are supporting together. We're also partnering with role models. We bring influencers, social influencers, and even digital male athletes in my county, because we also have gender-based violence by athletes, and we have brought them together. 4th, service delivery improvements, establishment of gender desks in our police station has also been another strategy. And 5th strategy that we have applied in my county is awareness and community outreach, hosting youth fun days as dynamic platforms.
We had 58,000 cases of AIDS-related deaths. In the year 2024, we had 21,007 AIDS-related deaths. In the year 2013, at the advent of devolution, 2013, we had mothers transmitting HIV to their children. Out of every 100 mothers who were HIV positive, 21 were transmitting the virus to their children. So we really commend the county governments for this effort, and together we see that it is possible to end AIDS as a public health threat.
As you can see, I am a community health promoter, the youngest in Nyeri County. So the challenges that we face is stigma and judgment from the healthcare providers, people who are the community people, and everybody at large. Because now what I would want us to do is please, and I say again, please, let's not shame people, because when I'm going at the health facility to go and get my ARVs, or even because I'm a girl, I also need the family planning. Don't stay there as a doctor, a healthcare provider, and start judging me from who you are seeing, but not understanding me, the journey that I'm going through.
Yes. How can you be involved better to deal with policies that will then deal with the triple threat? Do you want barazas? Do you want to be called to meetings? How can that work?
I can be involved better, not only to go and sign the participant list. No, I want to be at the table. When implementing, while discussing, implementing, and also budgeting, acha nikue hapo, wacha maoni yangu yasikike, si kuandikwa tu. I want to be involved as a young person. We have the skills, we have everything. The only thing is you are not utilizing us to the fullest.
All right.
This communication between parents and kids is very, very, very important. Like in my situation, I'm an experienced parent. I want to give you a short story of what happened to my daughter who got pregnant at the age of 13 years. She happened to have felt vulnerable or maybe succumbed to peer pressure and got pregnant while I was away. I was an upset parent. So this is my call to all those parents to be available for their children.
You've just asked, I forget her name, Jacinta, a very good question as to whether parents can really speak to their children
freely.
The truth is that the matter of sex is a taboo conversation. Our parents didn't discuss with us. We find it very difficult to discuss with our children. And we have, policy-wise nationally, we've even stopped. Sex education is prohibited in the schools. So we have prohibited sex education so that nobody else, I can't speak to my child because my Luo or Luya tradition never taught me how to discuss sex with my child. It was supposed to be a grandmother or an auntie. The school system has said no. The school cannot be the space where you can discuss this issue. But the policy on internet has opened the internet. So this child can actually go to a porn site and be taught anything around sex. If you Google if you write sex on the internet, it is unlikely to bring you sex education, what you should do at age 13. It is likely to bring you maybe porn sites. Are we worrying about that? Nobody's worrying about that. So my view is that nationally, we need to rethink. So we need to get back to find out, when the CHP tells you that we have 3 families with 13-year-olds who are pregnant, what does the chief do about it?
Okay.
Does the chief get elders to negotiate so that you commit the next crime, put that child into child marriage, another crime? What are we doing? We are not implementing the laws that are there.
Yeah.
We have treated this as a woman's issue. And in society, when you treat it as a woman's issue, it can wait.
Okay.
But when it is everybody's issue, you can do something about it.
If you look at our population currently, over 75% of our population is below the age of 35 years. Over 25% are below the age, or 26% are below the age of 25 years. And over 20% are among those who are calling them adolescent, between the age of 10 to 19 years. This is an age group that's really, that requires quality education, that requires good health, that requires other supports. But also they face a lot of risk, the risk of gender-based violence, HIV, early marriage, female genital mutilation. So it's important that these counties have the right data. And I think during the census, that's in fact the cohort that we consider, and also during the Kenya Demographic Health Survey. And that's why the reason we are saying, for us to harness our demographic dividend, for us to achieve our, our aspirations and goals as a nation, we must address the issue of teenage pregnancy, because we are losing a big chunk of our population who could have contributed to our country.
What strategies can now counties adopt to deal with the triple threat at a time when donor funding is shifting and increasingly becoming smaller with time?
And I think that last piece is important, because let's not say shifting, it's reducing.
Yeah.
Well, let's be plain. Donor funding is reducing. And the other reality is that there is a mindset that has been in place for as long as we've been here, for as long as Kenya has been in place, that the donors are going to take care of it. Whether it's HIV, GBV, or a teenage pregnancy, the donors are going to take care of it. And I think there's been a little bit of silver lining over the last 8 months, has been a little bit of change in mindset, at least in the papers, to say we should be taking care of this ourselves. And I'm happy with that. I'm positive about that. And you know, there's a really short answer to how do we get funding to come into place, and that is we put the funding in place in the budget and we actually realize that budget. And I think the challenge is that sometimes Treasury has put things in the budget with the full intention that they're never actually going to realize it, because they've put it in there to appease one of the other donors to say that oh yeah, we're covering it. And the reality is it needs to come in place. And that's both at the national level and at the county level.
How can development partners align their support to strengthen the localized efforts of fighting triple threat?
I strongly know that we are willing to do that, so that the clients, persons who are living with HIV infection, do not continue to be discriminated, isolated, and considered as others when counties are budgeting, when hospitals are planning their budgets and so on.
In my view, GBV is a security and safety matter. In fact, my recommendation to the Nancy Baraza task force is that we need Ministry of Internal Security to put funds to GBV to be the chair of a multi-sectoral team that deals with GBV, and on that multi-sectoral team we should have health, we should have education, we should have gender, we should have the judiciary, we should have ODPP in order, in real time.
Okay.
The Minister for Internal Security should be able to tell us, we had 3 defilements in Nyakach last week and we have arrested the people.
The challenge that we have had is actually about the reporting and the data collection mechanism that has been there. These people were reporting using a Mulika system. A Mulika system is where you take a kabambe, you type in, you say, today we had 2 defilements. So and so does. So 5 assistant chiefs send an SMS to the chief. By the time it gets to the chief, maybe the chief's battery is low. The chief is not able to open the message.
Yeah.
The chief cascades upwards to the ACC, from the ACC to the DC. So what you have done, we are supporting the Interior Ministry to come up with an online reporting system where the assistant chief report and the real-time data is captured in Nairobi.
All right.
So from a dashboard, you can actually be able to tell, in Marsabit, we had 10 reported cases of defilement.
Okay.
Then you go to the police and ask the police, what have you done? You go to the court. If these cases came to court, what did you do? The health sector, did these people come into care within 72 hours so that we can help them to put them on PEP, post-exposure prophylaxis? So we are working with them also on that.
Thank you very much.
Thank you all for your continued support in HIV response and in addressing others endemic diseases. May the Almighty God bless you all. Thank you.